We're finally seeing some evidence tonight that more people are listening to the warnings about opioids, fentanyl, and methamphetamines. And law enforcement's efforts to keep illicit drugs from reaching the U.S. are paying off. New data shows overdose deaths nationwide are down dramatically. Thank you for joining us here at 6. I'm Marie Morterra.
And I'm Dana Wagner. Jim and Latoya have the night off. Though deaths are down nationwide, we can't say the same for Nevada, which is one of just 2 states that saw overdose deaths rise in 2024. Our Steve Wolford joins us live here in the studio with this exclusive crime and justice report.
Yeah, that's right. The other state being South Dakota. According to new numbers just updated by the CDC, drug overdose deaths nationwide plunged 27% in 2024. That's huge. But even in the face of that tremendous progress, overdose deaths in Nevada were up by 3.5%. So why is it happening and what can be done about it?
Fentanyl is extremely deadly. It only takes 2 milligrams of fentanyl to be a potentially deadly dosage.
Kevin Adams is the assistant special agent in charge of the Drug Enforcement Administration's Las Vegas office and says fentanyl is a major reason Nevada has seen an uptick in overdose deaths. But unlike the rest of the nation, there's an even greater threat in Nevada.
In our state, methamphetamine can be attributed to causing more drug-related deaths than fentanyl at this time.
And Adams says that's despite a concentrated effort by the DEA and other law enforcement to curb illicit substances from China flowing to drug labs in Mexico, then into the U.S. and onto the streets of Nevada. So what else makes Nevada different in a way that our overdose deaths are still climbing, even though they're down significantly nationwide? Dr. Lisa Durrett, a psychiatry professor at UNLV's Krikorian School of Medicine, says,
there's a lot of unhoused individuals that we'll see. It's a rather transient town. We'll have people that are from, all over. So I think, there's some unique demographics to our town.
And there's also the reason people visit Las Vegas.
I think there's some of it being partying.
I lost my oldest son to a heroin overdose in 2011, and he was 19 years old. And at that time, I still am a person in long-term recovery.
Joe Engel is the founder of There Is No Hero in Heroin, an addiction recovery organization. He says a lot of help could come from Carson City, specifically the opioid litigation funds, the Fund for Resilient Nevada.
Those dollars have been sitting in the state treasury for years now, and I don't know how much of those dollars have actually gone out to the street to organizations like mine and many other organizations that are providing frontline services that could really benefit.
Well, there are a number of resources available to help Nevadans battle addiction and to curb overdose deaths. We'll have a list for you at news3lv.com. It's something to think about. The DEA says drug-related overdoses are still the leading killer of Americans between the ages of 18 and 44. That's almost hard to believe.
Yeah.
Dana, Marie, back to you.
And Steve, that is a reminder. There are the numbers, and then there are the humans behind every single one.
Absolutely.
Steve, thank you for that story. Well, along with the information on those websites, there are other types of resources available here where we live, many of which are free, including Narcan in the event of an opioid overdose. It's available at places like the UNLV Student Health Center and the Southern Nevada Health District. Dr. Lisa Durrett, the woman you saw in Steve's report, says the Health District also offers other ways to prevent an overdose death.
The chances of something being laced with fentanyl in our local community is really high. The Southern Nevada Health District and there's a couple of other resources do have free test strips available where people can test their drugs before they use them, but that requires somebody to seek out the resource, the test strip, and then actually use it appropriately, and then make a decision whether or not I'm going to use that substance.
Certain drugstores around the valley even sell Narcan or naloxone over the counter. It's important to remember Narcan will reverse an opioid overdose, but it doesn't work with a meth overdose.